Welcome to the Millcreek Government Channel. I'm Judy Zelina. Joining us on the program is a good friend of mine and a good friend of yours also. We have Judy Helcom.
Hi, Judy. How you been?
Good. It is so good to have you back on the program again.
Thank you. It's wonderful to be here as usual.
Judy, I'll remind you, is a registered nurse, and she is with the Erie County Diabetes Association, but she's retired. Ha ha, so she thinks.
That's right?
Yes. We keep bringing
One
you on
of these
here.
days it'll get closer, Judy.
But today, Judy and I have been talking, and we'd like to broach on a subject that I think is going to be familiar with many of our viewers. We're going to be talking about chronic health problems today.
Right. And kind of the way I would like to say we're going to use the theme of, if you don't like change, and there aren't too many people who do like change,
Okay.
avoid a chronic illness, because a chronic illness will automatically change your life, okay? So that's my goal is, yes, everybody hears chronic illness, chronic health problem. Yeah, we know about that. What's she going to tell me that's any different? You know what? It usually isn't any different, but we all need wake-up calls every so often to bring us back to reality. So.
Okay, and you're right. We've heard chronic health problems, chronic illness.
Right.
Okay, can you give me some examples of what we would consider a chronic health problem?
Okay, well, first of all, let's define a chronic health problem according to the CDC.
Okay.
Chronic health problem is any condition that lasts longer than 3 months that does not have a cure at this point,
all right,
but it can be either controlled or possibly managed. But the sooner you are diagnosed with a chronic health problem, the better the prognosis usually.
Okay, all right.
If you wait, which is the vast majority of people are what? Crisis driven.
Yes.
Okay, this has been bothering me, but I'll wait a little longer and hope that it goes away. The denial factor is really rampant, okay?
Yes.
Better if you have someone in your family who had a chronic illness and you can look at them and say, gosh, I hope I never have to cope with that. That might wise you up. For the vast majority of people, though, that's not the case. It's like, I'm busy with my life. I do not want to change my lifestyle habits, so just leave me alone or give me a pill. I'll take a pill. No, there is no silver bullet for a chronic health problem. Examples. I'm going to give you the top ones. There are a lot of chronic health problems.
Okay.
But heart disease and stroke are number one.
All right, okay.
Okay, cancer is number two. Diabetes, respiratory diseases, especially asthma, Alzheimer's, multiple sclerosis, oral conditions of the mouth. That was surprising to me, that who would ever think, okay, you have a problem with your gums or a problem with your teeth. Generally, you have some symptoms, so you kind of take care of it.
Right.
But it is a big contributor to disabilities, loss of work time, loss of productivity in general, and death from the, no, exactly. So those are some examples, but the lists go on and on. The important thing is to say to yourself, okay, what are my risk factors for developing a chronic disease? Can I put you on the hot seat as we usually do?
We always do. Why not?
So the most common risk factors that if we would at least try to address one of them is going to help us to ward off the majority of chronic illnesses. What would you say?
Do you know what I would say?
Okay.
I would say stress.
Oh, wow. And I put that,
that's a new one.
put that
Jeez, I
on
don't
the
have any of
list,
that in my
but
life.
absolutely, I totally
stress,
agree with you,
yes.
and I wonder why didn't they include it? But the primary one is lack of physical exercise in our lives. No, I'm not picking on you. It's the truth. Lack of enough regular physical exercise, okay? Second one is poor nutrition. And what do we mean by poor nutrition? not eating enough fruits and vegetables, eating too much salt and too much saturated fat, okay? Third one is tobacco. Smoking by far, single biggest risk factor. If you smoke now, you must think about quitting. Look at me, smoked one cigarette in my life. Thank God I don't have to cope with smoking. But people say, it's not bothering me right now. You have no idea the damage that is occurring throughout your body, not just in your lungs, okay? The last one is alcohol overuse. Those 4 risk factors contribute to the vast majority of death and disability with chronic illnesses. Now, we hear it in the news all the time. We should be walking at least, exercising,
right,
not bodybuilding, but doing something. Healthy eating is so important. You know what? We hear all these things, but our attitude is not for me right now. I do not want to change my current lifestyle. And if there's any message that gets through on this show today, that is it. You cannot avoid change. That's the only constant in our life is change. If you're going to keep avoiding it, it's going to come and haunt you anyway. So learn to embrace change. Small things that you can do, but to say, not for me. I'm busy going to work, I have a family, right, I have these other social activities. Fine, keep that attitude, and I can assure you, you're in for a real wake-up call down the line. And that's what I'd like us to prevent.
And I think it's so important, viewers, that with us talking about changes, I understand where Judy's coming from, because like right now, this minute, I might be saying, I feel fine.
Exactly.
I feel fine, you know,
this
what?
Is it. Right.
What, so I grab a donut for breakfast or something, you know,
right,
it's not hurting me, I feel,
right,
I feel fine. And
that's it.
And I go home from work, I work hard all day, and all I want to do is sit and watch TV.
Right.
Well, this is what our society is gearing us to. It's the fast foods, the sugar foods,
goodness,
and more
making
TVs
your life
and movies
convenient for you.
Exactly.
Right. And
so I can see why.
Oh my gosh.
I would say at this point, but I'm fine.
Yeah. Right.
But you are so right. You have got to, you know, take a hold of this.
Yes.
And, you know, direct your own destiny.
But how do you do that, Judy?
Well,
that is the
that's why
big
you're here.
Oh,
I know.
sure. Yeah, right.
Well, you know what it is? You have been wonderful at giving tips and advice,
right,
and how to change slowly.
Right.
And that's so important.
And I think so much of it comes from when you live the experience of chronic illnesses, okay, through family members, friends, loved ones. That's what, and being a nurse, obviously, always makes you look at that and say, gosh, if only this person had acted a little sooner and got diagnosed a little more quickly, we might have been able to help them. But you still have to deal with wherever the person is at right now and say, yesterday's gone, tomorrow's not here.
That's right.
But don't tell me you can't do a little something just for today.
Right. So it's never too late,
Never.
Is it really?
Well, for certain treatments
well, for certain
to be
things,
implemented,
but I mean,
yes.
what
but
we're
in
talking
general,
about is changing
absolutely. Obesity, I left that off in this major list of examples. Obesity is rampant in this country. We're supposed to be the most powerful, terrific country. When it comes to health care, we are very, very poor. In our own community right now, 35 to 50% of children in our community are either overweight or obese. What does that say for us as a community? So bad enough what we're doing to ourselves, but what are we doing to our children, the future of America? So we can't avoid these things. We can put our blinders on for a while, but if you listen to a show like this, I always say to people when they say, oh, I've seen you, that was really an interesting show. And I look at them and say, and what do you plan to do with the information that you gained? If it was just good to listen to, that's not a call to action. and we have to be at a call to action. So.
I think, though, too, Judy, we do have to have a call to action, especially for this chronic health problem, and really prevention and dealing with it.
Absolutely.
Prevention is little steps, and we may not be able to prevent everything.
No, of course not.
You know
no
that.
guarantees.
But there are some
you can
things
do everything
that
you're supposed to do.
But there are some things we can kind
Luck of
of
the
look
draw.
out for.
Yes.
And I would think if you're diagnosed or if you have any of these chronic health problems,
Okay.
it can be a very, very much of an emotional roller coaster, can't it?
Oh my gosh. Well, the first thing.
Because you're looking at no end.
Yeah, exactly.
This has become a part of my life,
It
right?
has to be, absolutely. And you've brought up such an important point. Dealing with your emotions about a situation is critical. So if you're first told, if I was told today, because my professional career is diabetes, if I was told I had diabetes today, would I be upset? You say, well, I don't know why you should worry because you're a diabetes educator and you've learned all this stuff.
Right.
It'll be cake for you. No, it won't. No, it will not.
No, it won't.
There's no such thing as a normal life, like people like to look at normal, okay? Denial, give yourself some breathing room. The doctor says something to you and you think, couldn't be happening to me. Impossible. Lab is wrong, whatever. I didn't give them enough information. Just let it settle. And then seek learning. You have to learn everything you can about that chronic illness in order to deal with it. Seek support. Roller coaster, yes. One day you may feel good and say, well, this isn't so bad. I think I can cope with it. And the next day it knocks you for a loop for some reason. Another symptom comes up, or you're disabled in some way. Pay attention to what your reaction is to that particular thing that's happening and try to get a grip on that first and then move forward.
Now, Judy, how important do you think it is to reach out to, depending on what the health problem is?
Yes.
You and I both know there are organizations for diabetes. There's organizations for cancer, for
Everything.
Alzheimer's, for epilepsy.
Absolutely.
Okay. How important is it, do you feel, to reach out to these organizations?
It depends on you as an individual.
Okay.
Like, if we had a little discussion here today about, Judy, what motivates you to take care of yourself and to be concerned about your health? What would be your immediate reaction? What is a strong motivator for you?
Mine is family.
Okay, so being able to enjoy your family,
Right.
being able to do what you do now that you
Exactly.
get enjoyment and
Independence.
satisfaction. Independence, exactly. So much of chronic illness is, if you've let it go on too long and haven't managed it, what happens is you start becoming a burden on other people as well. It's one thing for you to be affected and have to go through all these
Okay.
changes, but typically we got to draw in family, loved ones, friends, and you start seeing the toll that that takes on the people around you. So the stress factor is critical. So yes, there are organizations. Yes, there are support groups. I'm not a support group person. I've done a lot of support groups in my career, but a lot of people say, yeah, they talk about this, they talk about that. I want to talk one-to-one and get down to the nitty-gritty of what I'm struggling with.
Okay.
That's fine. Some people do well on the phone with support. Some people do better with strangers than somebody they know. It's like, can't you sit down with a family member?
Right.
Not necessarily, because that emotional part of it always comes in, and we don't want to let our family know. We're so upset, we got to be strong, you know, that kind of thing.
Right.
So, yes, whatever, look at yourself, ask yourself what motivates you to take care of yourself and why, and then seek support and help that will help you to continue to do what you've been doing. Quality of life, to me, is the bottom line for everything.
Number one for me.
If you're going to tell me I'm changing my life right now, I'm going to say, yeah, Guess what? No, because I'm feeling pretty good.
Right.
So don't bother me, or give me that pill, silver bullet. It's not going to work that way. That's the trouble with chronic. So.
Well, I would have to say there's a lot of different coping strategies too.
Oh my gosh.
Now, we talked a little bit about, you know, what it's an individual choice whether you go to an organization, a support group. I'm sort of like you, Judy. I'm like a one-on-one.
Yes.
And
Right.
I'm very fortunate, but I've been able to work things through by myself.
Right. And you're good about asking questions, is my sense. Yes. Which many people are not. Go to the doctor.
Right.
Well, the doctor knows best. No. This is your body, your spirit, your mind. So you've got to get connected with yourself. We don't look at ourselves enough, I don't think.
Okay, here's a question. You brought up doctors.
Right. Okay.
Okay, I think when you do have a chronic health problem,
Okay.
you of course have a doctor that you're working with.
Right. Or more than one
Or more
doctor.
than one doctor.
You got it.
And I think you have to have a comfortable relationship.
Absolutely.
And what about asking questions? What about taking notes, like during your day, for a question for your next doctor's appointment?
You have to prepare. And how many people would you ever see taking a piece of paper with them to their doctor's visit? It's always controlled by the doctor. Okay, how are you doing? Oh, I'm looking at your lab work and this is what it says. Let's get at what you're experiencing. And the other thing is coordination of care is so important. If you have to see more than one physician, have you ever gone to one doctor, then you go to another doctor, and they start at the very beginning with you? Okay, how many surgeries have you had? What medication? No. The electronic health record that a lot more physician offices are
Right.
getting into is tremendous.
It is.
And the sharing between doctors.
Right.
But that's only as good as the information we provide them with, okay?
Right.
And a lot of times, if I said to you, have you had your flu shot? Have
I
you?
have. Yes, I
You
have.
have had your flu
Yes, I
shot?
have.
Okay, I have not yet.
Okay.
All right. Have you had a pneumonia vaccine?
No, I have not.
Okay. And is it important that you have these things? Oh, we're told day in and day out that you have to get immunizations to protect you.
Exactly.
But I haven't gotten around to it, you know? But keeping a record, because
Right.
that's one of the first questions they ask you.
They'll say, when was your last pneumonia shot?
I think I had it, but I can't
Right.
remember what. That's not important, is it? Yeah, it is important. It really is.
So keeping your own records.
Oh, absolutely. Keeping a medication list on you. When your medications change, notifying your primary health care provider, whatever. Yes. Again, people don't like numbers. They don't want to write stuff down. And number two, they don't want to carry all this stuff on them. Okay.
I'll tell you though, speaking of doctors.
Yes, right.
When you do go to the doctor and you do have any tests done, the results, especially like my blood work, I always ask for a copy.
That's it.
Because what I do is I compare it, and
Right.
I'm just sort of like a nerd
But
about
how
that.
come?
but-
You're like playing a mini doctor then? Shouldn't that be the doctor's concern and not yours?
Well, he tells me that everything's okay, but I just like to look at it.
Exactly.
And I like to have a record of, if someone says to me, you know, what is your, you know, your bread count or your
Yes,
white count?
right,
and everything.
right.
I can't tell you now because I didn't bring it with me. I usually do.
Exactly,
But here's
right.
the funny part is that my doctor, when I go to him for my blood work or any tests, he'll say, and here's a copy of it, Judy, because I know I watch your shows and you say, honestly,
Get a copy. Oh
get a
my
copy.
gosh, now see, that's fantastic.
Isn't that
To hear
fantastic?
that, yes.
So that's actually a physician who says, I watch these shows,
Yeah.
and I know that you like to have a copy of your blood work and any test results, but they're yours, so you can ask for them.
That's
just
it.
for your own record. Make any
Exactly.
notes. This is when I got my
And-
flu shot on that day too.
Right, and if you're ordered to have blood work, take it upon yourself when you go to have that blood work before they start doing the paperwork. I would like a copy of my results mailed to me. There is no charge for that. They will do it.
Right.
They first have to send it to your doctor, have him or her evaluate it, and send it to you. So what is so tough about that?
It isn't, and it's a small step
It
in
is.
taking control.
There it is.
Taking
It is.
control
and motivating
of
yourself to
your
stay
health.
on target.
That's right.
Absolutely.
That's
Yeah.
right.
Yeah.
So prevention let's sort of sum up what we've talked so far. Prevention is really, really important for a lot of these chronic health problems.
Right.
Not all of them.
Yes.
But, all right, then there's also different coping mechanisms that we've talked about. Now, once I'm diagnosed,
Okay.
I'm diagnosed. I've gone through the roller coaster of denial and everything. What is my next step then, Judy?
That would be according to what you're experiencing, either emotionally or physically with some symptoms.
Okay.
Okay, so a frank discussion first with your physician.
All right.
And then a discussion about, besides yourself, doctor, will I need to see a specialist for this particular condition? Can you help me get someone that I can have a good rapport with? Because you're absolutely correct. A relationship with the healthcare provider, to me, is 99% of how you're going to do. If you feel comfortable and can be frank and open discussions with the person,
right,
you're going to be further ahead.
You will.
But if it's like, okay, just tell me everything I need to do. Tell me exactly what I need to eat, give me the prescriptions, and send me on my way. I'm sorry, but you're in for a rude awakening. I keep coming back to that statement because it's true. Never lose hope. Never lose hope. But plan for the worst and hope for the best. If you do not plan for what may be coming in the future, that's where you're going to run into big time problems. So,
Judy, when we talk about prevention and everything, you talked about exercise and diet. I find that difficult. I find it hard for some people to incorporate that in their lives.
Because
of their lifestyle, because of their busyness, because they're not home all the time. They've got meetings after work. They're grabbing something on the fly. How would you help these people or give them some direction if they come to you? Because I know, Judy, in the time that you've been working with people, people will say, but Judy, really, I mean, I want to do this, but how do I do it?
Exactly. And that is the $1 million question. How you do it is just for today. How about if this morning I got up out of bed and I said to myself, just for today, I'm going to focus on something to improve or maintain the good health that I have right now, just for today. If we did that and it became a regular habit, that would keep us motivated. But if we immediately get into automatic pilot, I got to take my kids to school, go to my job, keep this appointment, do that. You see how those things are taking the priority?
Yes, they are.
If health is not your priority, where are you going to be?
You're not going to be able to take those kids to practices
but
or
you
go to
see,
school
that
plays.
Sounds like up in the clouds. Yeah, we heard that before.
Because again, I feel good right now this minute.
This is it. But you heard these things before, but what you're saying is, how do I incorporate it into my being here? That's an individual thing that I can't tell you. Now, if I deal with you on a one-to-one basis, like both of us, I would get under what I call the outside layer of your thinking. So is it really so tough to pass up a McDonald's hamburger? Can you go to McDonald's and get a salad just this one time? You're going to say, but I feel like I'm denying myself. Come on. I worked hard today and I want my reward, my cookie.
Because we deserve it.
Exactly.
I use that excuse all the time. I deserve this.
Exactly. And it's not going to hurt me just for today.
Yeah, one time.
And today becomes tomorrow, next week, next year.
Yes.
And coping with chronic health problems.
So, okay. Now, Judy, what community resources are available?
Okay, the best one that I would like to refer people to, if you have access to the internet, is the Gannon Human Services Directory. Now, it used to be you could buy the copy of the directory at their bookstore, but now they've made it available online.
It's electronic.
So
yes.
if you go to the library and get access to the internet, hsd.gannon.org. edu, okay? And you go there and it will list all of the organizations that are available, kind of what their missions are, how they can help, support groups. The best place I have found for support groups, though, if you want to find out where there is one, because there are multiple ones in our community, is to go to goerie.com.
All right.
And type in support groups.
Okay.
Okay. And then the last one is the Erie County Department of Health.
All right.
They are loaded with all kinds of information and can get you referred.
Okay.
Now, in using diabetes as my favorite
Right.
example of a chronic disease that requires constant vigilance, okay, it's worse than a hangnail. Call the Erie County Diabetes Association because you can get that one-to-one discussion with a person who is really going to connect with where you're at and not just hit you with a bunch of facts.
Okay.
Okay, so, but there is a lot available in our
out there
community.
for us.
But people always say to me, I didn't know that existed. Okay.
Now you do. Now you know.
Right, exactly.
Oh, Judy, our time is up here, but boy, I'll tell you one thing.
Unbelievable.
Again, we can talk and talk and talk. It's wonderful.
We can.
Great having you back on the program.
It's great.
You always have a great topic. You've got great information. She's helped me change my life with little steps,
Right.
and this is the woman that's responsible for it. So
Really, and remember, plan for the worst, but hope for the best.
great words, Judy. Thank you
Okay.
so much for joining us.
Thank you, Judy.
Viewers, thank you for tuning in to the Millcreek Government Channel. And until next time, have a wonderful day.
You're watching the Millcreek Government Channel, powered by WQLN Public Media.